No new negotiations scheduled yet between Johns Hopkins Medicine and United Healthcare. Some 60,000 patients across Maryland lost medical coverage because of a contract dispute and have to find other doctors. They remain in limbo as open enrollment for next year's coverage begins.
It's very discouraging because these are two healthcare giants, Johns Hopkins and United.
Delegate Bonnie Cullison and other lawmakers are hoping to find solutions.
You want them to be negotiating in good faith, and you want them to come to agreement with a focus on patient. And I'm just feeling like they may not have tried hard enough.
Cullison is vice chair of the House Health and Government Committee and chair of the Insurance and Pharmaceutical Subcommittee. She says the bottom line, both the healthcare provider and insurance company are businesses. The core of the breakdown, providing treatment and keeping costs down.
When your healthcare system is based on business model, which ours is, they have responsibilities as business entities to maintain themselves.
But despite all that's going on or not going on, isn't the real impact on the patient?
Absolutely.
The Maryland Insurance Administration is also monitoring the situation.
Our job at the Maryland Insurance Administration is really to make sure that consumers are protected and held harmless as much as possible.
Delegate Cullison says these are free market negotiations, and under Federal Trade Commission laws, the state is limited in what it can do. She's considering legislation that could include a mandatory cooling off period, maybe 30 to 60 days, and expanding the continuity of care coverage. Right now, it allows patients to see their current doctor for 90 days in certain cases, including if they are pregnant, terminally ill, or have a rare disease. Cullison wants it to also include behavioral health. Looking forward, she's hoping United Healthcare and Hopkins can go back to the table through mediation or arbitration.
When you have an arbitrator, it will always be, there'll always be a compromise both sides are giving in order to get to agreement.
If the hospital and insurer do reach an agreement, could a similar issue appear again?
My hope is not. My hope is that is not the signal of a trend.
And what about any other steps the state could take to prevent it?
I don't believe that there's any legal way for us to do that. Again, it is about free market, about negotiations.
Delegate Cullison says she absolutely worries about this happening again. For WBAL TV 11 News Investigates, I'm Barry Sims.
Barry, thank you. Both Johns Hopkins and United Health are pointing the finger at each other for not being able to come up with a deal. Hopkins saying United refused to agree to reasonable contract language and, quote, chose profits over patients. United saying that Hopkins' demands were unacceptable and saying that they are still partners with many medical systems in this region, including University of Maryland Medical System, MedStar, and others.
And as a matter of transparency, United Healthcare is the insurance provider for our parent company, Hearst.
In the WBAL TV mobile app, we have resources to help you navigate finding a new doctor if yours recently went out of network, as well as insight on how to handle if you have a claim that is denied.